When COVID-19 first arrived in Michigan in mid-March, hospitals had to quickly pivot to turn their full attention to treating patients with a disease we knew little about. At teaching hospitals like the University of Michigan, it also meant pulling medical students out of their clinical rotations for their safety and the safety of patients. Today, we're talking to some of those students about their experience, how it felt to have their routines upended virtually overnight, and what they did to respond to this new and familiar situation. With me today is Dr. Rajesh Mangrulkar, Associate Dean for Medical Student Education, along with two medical students, Clare Anderson and Ali Hammoud. Welcome and thanks for joining us today. Dr. Mangrulkar, let's start with you. I know the number of hospitalizations for COVID-19 has dropped significantly since the first weeks of the pandemic, but can you give us an idea of what it was like in the hospital in those early days of the crisis?
Sure, Marty, and thanks for inviting us here today for this conversation. We started building out extra intensive care unit beds, making sure we had adequate supplies, and started planning for a remote field hospital as well. So there was a whole arm that was really doing a lot of planning. I don't think any of us had really been involved in such an operation where things were going to ramp up, people were going to be deployed, and we were going to need to change on the drop of a dime. So you could definitely sense the anxiety. I will say in our medical school education program and for our medical students, we started planning in February saying what happens if we needed to go remote. But most of us were really thinking that we would be able to really still keep our medical students engaged in the clinical setting and maybe just in the classroom setting, alter things. But it became clear that things were changing so dramatically and so rapidly that we needed to pivot quickly and temporarily suspend our students' involvement in direct curricular activities in their clinical rotations, but still make sure that they were still learning.
Thank you so much. Let's hear from the students themselves, Claire and Ali. Tell us what it was like for you and other medical students in the early days of the pandemic. It must have been disappointing being pulled away from the patients you had been treating.
There was definitely the disappointment, but I think it was quickly followed kind of by this enthusiasm to participate in other ways and help out. And when I think back on those first couple of weeks, right after we got pulled off, I think more of that positivity, honestly, and how quickly we all pulled together. So.
Ali, can you tell us a little bit about how you students pitched in and how you quickly got involved in the helping out at Michigan Medicine?
Yeah, so on March 14th, our rotations were truncated and we were pulled from the hospital. And actually on March 17th, we had already launched a new M-Response Core. We had partnered with the administration to launch this group, which ended up engaging actually 500 medical students of the 700 students at the school. And we were able to contribute both to the Ann Arbor community and supporting the health system.
I'm particularly interested in the No One Dies Alone program that students started at the school. Can you tell us a little about that and how it played out?
Yeah, so the No One Dies Alone program was something that was pre-existing before the pandemic. It was a program where volunteers would sit with and be with people at the end of their lives who didn't have family who were able to be with them. And they had a robust training program. And one of our medical students, Stephen Davidson, partnered with another one, Nadine Ibrahim, and they worked to revamp the training program for online use, and then actually engage a number of students to sit at bedside or right outside of the rooms with an iPad or a tablet to spend time with people whose loved ones couldn't really enter the hospital, especially in April when the visitor policy was so restrictive. So I think that those experiences made a lot of difference for patients, having someone who was committed to spending time and just talking with patients.
Mm-hmm. Can you tell us, Claire, a little bit more about the donations and the sorting? And I understand there were students that delivered food to vulnerable senior citizens. Can you tell me a little bit more about that?
Yeah, absolutely. So I think one of our largest initiatives was this large donation center that we had up on the North Campus of University of Michigan for weeks, all through, March and April. We had students go there, sorting through everything, kind of getting all the equipment ready and labeled to disseminate wherever it needed to go. And we did have a number of programs also specifically geared towards the geriatric population. One you alluded to is the grocery delivery, where medical students would go grocery shopping for geriatric or other vulnerable populations, those with comorbidities, in order to decrease that risk for them. And honestly, many, many more. There were a lot of really great initiatives.
It's just amazing. 500 of the 700 students got involved during the pandemic. I mean, this must be what people remember, like will mark your medical career going forward, don't you think?
I just want to reinforce what Claire and Ali have been saying. I really think that we look for those attributes of wanting to serve and have impact on populations, whether it be through research or through service or through leadership. And there was just tremendous student leadership and collaboration that marked the pandemic. They will always remember that. And I couldn't have been more proud in my 10 years as Associate Dean to see them step up.
Thank you. I want to thank all three of you. I know how busy you are. I'm glad you could take time out to talk to us today. We greatly appreciate your insights, and we want to thank you and the entire healthcare profession for all the heroic work you have done during these unprecedented times. Thank you again, and please stay safe.
Thank you.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.